It's Oral Health Friday. So today I'm going to show you how to floss your teeth or use a water flosser. Brushing alone cleans 60% of the surfaces on your teeth. The remaining 40% comes from cleaning in between. You can use floss on a reel, so you want to pull a long bit, cut it off, and then wrap it around your finger there, and then use that. So the idea is we want a C shape around the tooth. So rather than do that and shove it up there, you want to C shape it around the tooth. You want the back and forth motion and go slightly under the gum. And before you come out, C shape it to the other side, like that. Every gap once a day. Before you brush your teeth. You can also use floss picks. On a pick, this one is a cross flosser, so it's actually got two. Same technique, slightly easier, a little bit more expensive. Here you go in, and then again, C shape, cross, and I've drawn blood. Why did I draw blood? Healthy gums do not bleed. So I have an unhealthy gum because I'm not flossing enough. The more you floss, the less it will bleed. If you're new to flossing, after about 3 or 4 days of flossing on a daily basis, that bleeding should stop. And then you want to carry on with that. Every gap, every day. If you don't like that, you can try a water flosser. These are a little bit messy. This is a water pick range. Sonicare also do a range. You want a pulsing action. You want to be hanging over the sink when you do it. Get it the angle you want it. And then are you ready for the mess? This is why I should do it over a sink. I'm going to show you how to pulse it. There you go. That's why you do it over a sink. And then you go every gap and you move it around. You may want to turn it on and off and move around to get your angle. Water flossers are great if you don't like flossing. If you have bridges, if you have implants or crowns, you can get right underneath around them and in between all the teeth, and the back teeth is quite good for as well. If you have large gaps, then TP brushes are better, or other interdental brushes, which are the brand you want to use. I should demonstrate that as well, shouldn't I? Let me pause my video while I go get some. I didn't prepare myself. So TP brushes come in, and other brands come in different sizes. So I'm using a TP brand for demonstration. They come short handled like that, or long handled like that. Red one's probably about my size, so I use the back of that to get to the back. So where the gaps are bigger, the little brushes are better than the floss. Again, you want to do this daily, ideally before you brush, but any time of day, even if you're putting it in, doing it in your shower. However you can fit it into your schedule. In and out. To get the stuff out that you don't want, the stuff that causes tooth decay, things like plaque or food stuck. It also causes bad smell, so get it out. There you go. And to get the correct size, other than visiting your dental hygienist, of course, or your dental therapist, or your dentist, ideally your dental hygienist, obviously, then, or dental therapist, but a lot of you probably don't even know what a dental therapist is anyway. Other than that, yes, you want to have a little bit of resistance as you go in with that brush. If it goes in too easy, you want to go up a size. If it doesn't go in, don't force it. You want to wiggle it. Wiggle, wiggle, wiggle. If it doesn't wiggle in, then go down a size. The biggest brush you can get in, the better. The correct size brush to remove the plaque and the food so you can be healthy and have healthy gums. Not like me, because I've not been flossing. So be healthy, be happy. I'll put the link below for the professional water pick, how to do. They have their own YouTube one, which is really good. So I'll put that in the link below. I'll put that in the link below. If you have a water flosser, then you can click that for the correct technique. If you want to buy one, I'll also put the link on where you can buy it. Goodbye. Be healthy and be happy.